Good morning. Today I'll be presenting on the National Aged Care Quality Indicator Program, which is one of the most important tools for continuous quality improvement in residential aged care. I'll be focusing on four key areas: describing the tool, explaining how it is applied, critically analysing its advantages and disadvantages, and considering its overall effectiveness in ensuring patient safety. Continuous quality improvement is vital in healthcare, particularly in aged care where residents are frail and vulnerable. The National Aged Care Quality Indicator Program was introduced in 2019, is now mandatory for all residential aged care providers in Australia. It provides measurable data about resident outcomes in key risk areas and allows providers, regulators, and families to monitor whether care is safe and whether it is improving. The program requires facilities to collect and submit standardized data on outcomes that are most closely linked to resident safety and well-being. These indicators include falls and major injuries, pressure injuries, unplanned weight loss, hospitalizations and emergency transfers, medication management such as antipsychotic use, and consumer experience. These quality indicators were chosen because they represent common risks in aged care that can lead to significant harm if not managed properly. By collecting and reporting this data quarterly, facilities can benchmark their performance against national averages and identify areas for improvement. At a facility level, managers and clinical leaders use quality indicator data to identify risks and guide interventions. For example, a facility with high falls rates may implement targeted exercise programs, review medications, and adjust the environment to reduce hazards. At the regulatory level, the Aged Care Quality and Safety Commission monitors quality indicator submissions to identify underperforming facilities and ensure compliance with the aged care quality standards. For consumers and families, the tool provides transparency and reassurance. Families can access quality indicator data to compare services and ask meaningful questions about safety. The program is particularly valuable in contexts where residents are frail, on multiple medications, or living with complex health conditions. There are several clear advantages of the Quality Indicator Program. First, it provides a standardized national framework, ensuring consistency across facilities. Second, it makes hidden risks visible. Many issues like malnutrition or inappropriate medication use develop gradually. By requiring structured monitoring, the program helps identify these risks before they escalate. Third, it encourages a proactive approach to safety. Instead of waiting for complaints or incidents, providers can use quality indicator data to prevent harm. Finally, the program has an educational value. It helps staff link their daily care practices to measurable outcomes and reinforces a culture of continuous improvement. It also empowers consumers, giving residents and families access to performance data that supports informed decision making. However, there are important disadvantages to consider. First, workforce pressures can affect data accuracy. Staff shortages and workload often make data collection difficult, and reporting can be seen as an administrative burden. Second, quality indicator data may lack context. For example, facilities caring for residents with advanced dementia may have higher falls rates despite excellent care. This makes comparisons tricky. Third, there is the risk of gaming the system. Providers may underreport certain events, such as falls without major injury, or categorize weight loss as clinical rather than nutritional. Finally, quality indicators do not measure all aspects of quality. Factors such as dignity, social connectedness, and emotional well-being are central to aged care, but are much harder to quantify. Despite these challenges, the Quality Indicator Program has shown effectiveness in improving safety and outcomes. Facilities that actively use quality indicator data report fewer falls after implementing prevention programs, reduce pressure injuries following staff training and repositioning protocols, and lower antipsychotic use through dementia specific non drug interventions. The tool also supports decision making at multiple levels. Boards and executives can allocate resources more effectively, for example, by investing in nutrition support if weight loss is identified as a concern. Nurses and care staff can use quality indicator data to target residents most at risk. And policymakers can track national trends and adjust regulation or funding accordingly. The program's success, however, depends heavily on leadership and culture. Where leaders treat quality indicators as compliance, staff disengage and improvements are minimal. Where quality indicators are framed as opportunities for learning, staff are motivated to act and change occurs. Another measure of effectiveness is consumer empowerment. Families now have access to performance data that helps them make informed choices and hold providers accountable. The tool is also evolving. The Department of Health and Aged Care is expanding indicators to include incontinence management and restrictive practices. This will broaden its scope and make it even more effective in protecting resident safety. In conclusion, the National Aged Care Quality Indicator Program is a cornerstone of continuous improvement in residential aged care. It provides measurable, transparent data on key risks, supports proactive interventions, and empowers both providers and consumers. Although it faces challenges with accuracy, context, and scope, its overall effectiveness is significant, particularly when embedding in a culture of accountability and learning. By shining a light on critical risks and guiding improvement strategies, quality indicators play a central role in ensuring safe, high quality, and dignified care for older Australians.